This is another question that is so commonly asked. Can um, gynecomastia go away with exercise? And this is a question that I think I have answered many times. Gynecomastia, as you know, is a combination of fat and gland, which is a breast tissue which develops during puberty because of activation of estrogen. So now, having said that, a lot of them try to fix the gynecomastia just by exercising. What does exercise do? Exercise works purely on fat, which means it can reduce the amount of fat in your chest, but it can never take away breast tissue. This is the same concept as if you would ask a woman who has had a larger breast and then over a period of time loses weight, what happens to her breast? The fat in the breast reduces, but the breast tissue, which is the gland which produces milk in women, that does not reduce in size. So the same thing with men. If you go to the gym, work out, diet, what happens? The fat might reduce and go away, but the gland never goes away. So even in bodybuilders, as you know, a lot of bodybuilders who take anabolic steroids, as an offshoot, develop gynecomastia and a puffy nipple behind their nipple, because of which they come to us to remove that gland. So you imagine this, a man who is probably in that less than 10 fat percentage group still has a puffy nipple and a gynecomastia. Why? Because even though he does not have fat, he still has a lot of gland, and that gland only can be removed surgically by a procedure. There is nothing else that can be done to remove the gland. So gynecomastia is a very common condition in Indian men, probably because of genetics, because of the kind of food we eat, or the quality of the food that we eat during puberty, because of which we might have as you call a gynecomastia or a man boobs in our body. So like I said, it does not go away with exercise. You will need a procedure for gynecomastia because of the gland. Thank you. Hello everyone, today we're going to be talking about the cost of gynecomastia, something that is hardly discussed. You have to understand why there is a cost in gynecomastia and why some people give it for a very less rate, some people give it for a very high rate, some people are in the middle. The cost of gynecomastia depends firstly on, like any other surgery, it depends on the expertise and experience of the surgeon. The more number of years, the more expertise, the cost will be higher. It depends on whether you're doing it in a clinic or a hospital. That that adds to the cost. It also depends on the technology that is used, whether they're using a certain kind of machine for liposuction, whether depending on the grade of gynecomastia, the grade 1 and grade 2 might cost less, grade 3 and grade 4 might cost more, because then you also require, along with the liposuction, you need tightening devices like Body Tight to shrink the skin. So and then sometimes you need to remove the skin as well. So depending on these, there is a range. The range is usually between 60,000 to 1.2 lakhs. This is why it is important to understand why there is a range, because of all these reasons. But I hope it has helped you in understanding what is the basic cost in India. As you can see in these pictures, we are talking about anabolic steroids. The patient here, who has been working out for many years, had taken anabolic steroids for a period of time, because of which they develop man boobs. So you can see, even though his chest is nice and chiseled, the lower part does have a breast tissue, and that breast tissue does not go away with working out or by weight loss. So we went in, got the gland out. As you can see here, there are no scars. The gland is completely out, and you can see the masculine shape of the chest is completely retained. This is very common in bodybuilders and in people who are taking anabolic steroids. So take care and make sure you have a supervised medical professional who is helping you with these medications.